Thanks everybody for joining. I love seeing so many familiar faces. I'm going to close these pictures. We will get started. We are recording this, so you can go back and listen to a snippet that you may want to revisit as you start the RFP process. And once we get it downloaded, I will get it onto the website. I will show you where all of that information is on our website at the end, in case you haven't already been there, taking a look at everything. So thank you for joining. We are going to try to make this as quick and painless as possible. Hopefully for all of our current providers, a lot of this is just a great review for you. And if you are a new provider, welcome. This is not your first Zoom call. These are things that you should already know. Mute yourself when you're not talking. If you have questions, I think it's best for you to interrupt me. That is fine. That we have factored time in for lots of Q&A. This is the time to do it. You are also welcome to drop it in the chat. Amanda is monitoring the chat. She will either respond in the chat or she'll stop me and ask me to answer the question. And then when it's Amanda's turn at the end, I'll flip-flop that. So I'm going to be going first. We're going to be talking about all the things you need to know as far as contractual obligations, the services that you can write for. And then Amanda is going to finish us off going into the nitty-gritty details as far as the actual submitting an RFP. Here's what the software module looks like. Here are the questions that you are going to answer and how to do a budget and how to get yourself a login and username, et cetera, et cetera. I'm going to try really hard to, if I use an acronym, to explain what that is. I do have a lot of alphabet soup though, so if I say something and you're like, what in the world did she just say? Stop me, because it is important to make sure that I don't speak in acronym slang. A little bit about kind of where we sit in the structure. We are part of a COG, a Council of Governments. People normally just call us Northwest COG is the easiest way to say it. We are basically a membership organization of 30 jurisdictions in now 6 counties. This is a list of the departments within the COG. You'll see us at the bottom. In November, route transitioned from region 11 into region 12, which is our region. So for the COG, route is already part of our 6 counties. For the Area Agency on Aging, the AAA, that will go live on July 1st. That was a decision between the 2 COGs and the county commissioners, because to make the AAA services as seamless as possible and to be able to get new route county providers into this RFP, it was decided that having a longer transition a longer transition period was better for everyone. This is the vintage team. We'll start off with Amanda. If you already know Amanda, if you are a current provider, she is our budget and database and OAA-SYS queen. OAA-SYS is the acronym for our reimbursement software. Jana in the top middle is our SHIP Medicare counselor. Cece on the right runs our caregiver and voucher program. She is also our bilingual staff and fluent in Spanish, as it is her first language. Tina on the bottom left is our long-term care ombudsman and the RSVP coordinator in Eagle County, and I am on the right-hand side, bottom right. These are the services that we provide internally. I'm going to go ahead and apologize that these slides have a lot of information. I know that is slideshow 101 to not put a ton of stuff, but my hope was that this could be a reference tool in the future. All of these slides from Amanda and my presentation will be on the website, so you can always go back and look at them. That's why they're text heavy. I apologize. I'm also not going to go through and read everything. Just a few things I want to point out if we look at a really text heavy slide. If you don't know about our quarterly e-magazine that Amanda puts together, it is beautiful and full of really great information. I would suggest that you sign up for that. It just comes as an email once a quarter. And once a quarter, if you are a provider, you should get an email from Amanda that's like, hey, is there anything that you're doing at your organization that you want us to include in our e-magazine? You'll also notice that I put with all of our internal services, the name of the person who runs that. So in case you ever have a question about, oh my gosh, we have a client who's in a long-term care facility in our county, and I have a question for the ombudsman. I can't remember who that is on the team. You should be able to look at this and be like, okay, I need to contact Tina. These are a list of our service providers. So these are our current contractors who have contracts right now. Just thought that that might be a good way to frame the conversation on kind of who we already contract with within our 5 counties. As soon as this is over at 11 o'clock or whenever we're finished, we will go into a quiet period. That means that you can ask me a question that has to do with contracts or with services, and I will answer you, but I'm going to answer it and post it on our website. I will show you where that is so that everybody has the same access to the same information. So don't be shy about asking a question. I'm just going to let you know that if you send it to me in an email, I'll respond to it. I'll post it. I'll let you know that it's been posted, but that way everybody has the same information. That also then would behoove you to occasionally check that document, that PDF document on the website to see if anything new has been added. This does not count for anything IT tech related. If you are having issues with the software, let us know and we will answer that immediately, and we'll answer you. And hopefully if it's a software issue, it'll fix the problem for everybody. Kind of wanted to give you a 30,000 foot level of things that you should know that I am not going to go into detail on this presentation. If you are a current provider, you should already know this. If you're a new provider, we'll have a new provider training and we'll go into the details there. But just want to let you know again about this e-magazine. That's awesome. This is our website. There'll be lots of references to this in this presentation. We have a Facebook page that we religiously keep updated. So if there's anything you want us to put on our Facebook page, let us know, we can add it. This is a link to our 4-year area plan. We'll start working on a new area plan next year and submit it in the spring of 2024. This is the document we are required to provide to the feds. And it's basically, what are we going to focus on for the next 4 years? So if you want to take a look at what our current 4-year plan, it's funny because none of us knew a pandemic was coming. This is kind of where we are smack dab in the middle of. Every February, we are contractually required by the SUA, the State Unit on Aging, to send out surveys to 50% of the registered clients. We have always chosen to do that on behalf of our clients, or on behalf of our providers, so they don't have to do that. We have to do an emergency preparedness plan, which is less of a preparedness plan and more of a phone tree. So I would be contacting you as I am writing that for the SUA, the State Unit on Aging, just to say, is this contact information correct? Is this still your county emergency preparedness person? APAC, the Aging Policy and Advisory Committee, is the committee with the SUA that updates policy and procedures. It's just a good term for you to know. In case you ever see Alpine Area Agency on Aging and you're like, who is that? What's going on? That was our name a year and a half ago. In July of 2020, we updated our name to Vintage. This is a link to our P&P, the Policy and Procedure Manual, and the volume 10, which is the P&P, I'd say, is the very granular, here's all the very specific nitty gritty compliance things. The volume 10 is a little bit higher level than that. And then the Older Americans Act is a higher level than that. Annual evaluations. You will have an annual evaluation from us every year. The P&P says it has to be in person. Because of COVID, it's been virtual, but hopefully we'll get back to being able to do it in person. If you are a new provider, you will have a 90-day new provider evaluation. That is a requirement in the PMP. Additionally, the State Unit on Aging, they do an annual evaluation on us. And each year they choose a couple services that they want to do a deep dive on. And because of that, it normally means they almost always choose nutrition. So my nutrition providers know that they'll normally want to have a meeting with one of you every year as well, just to go over some stuff, talk about program income. It's one of their favorite things to talk about, that and background checks. So those are kind of the evaluations that you're looking at. Assessments. So this is the list of all of the services that require an assessment form. All those assessment forms can be found on our website, and or you can email any one of us and we can send you a PDF copy as well. So if you are applying for a service and you see that on there, there is an assessment that you will have to complete or the client will have to complete. There are different types of assessments based on the different type of service. The assessment forms are created by the State Unit on Aging. Amanda and Cece on our team make them prettier and more accessible. They are updated every year, and they actually might, I just realized they might not be updated anymore. We went through a huge change in assessment forms a couple months ago, and the reason why they were updated every year is because income changed and there were all these boxes about where is your income range. That's been taken out. So I actually don't know if we're going to be updating them every year. Stay tuned. Assessments are in English and Spanish. You can find them on our website. Just check to make sure you're using the most up-to-date assessment form. Reassessments. Those 5 services are the ones that require a reassessment. If you are a transportation provider, you can do one assessment. That solves everything. If you are one of these 5, providing one of these 5 services, reassessments are required. You have to do them every 6 months. So it's not necessarily 6 months from the last time that person completed an assessment, but it's within a time frame. So it's July to December, sometime within there, you have to do a 6-month reassessment, or January through June. If you are a new provider and have questions about this and you are selected to provide services, we will do a training and get way more in the nitty-gritty of this. Database. So providers are responsible for entering in the data, the units, the assessments, if you are a provider with rosters, into the current database system that the SUA provides, which is currently called PeerPlace. The state has a goal to have a new database system in place by July. They are currently, I think that it's going to be a Salesforce platform, and it's going to be, instead of the one that's PeerPlace, which is a totally different company that provides that. Before PeerPlace, it was SAMS, which was a totally different company. This is going to be something created by, run, and managed by the State Unit on Aging. So it'll be different, and hopefully we will get quicker responses. And if there are things that we need, it can be built in now or in the future, whereas we haven't really had that opportunity in the past. We will be training current providers and new providers on this new database system, whatever it is and whenever it starts. Reimbursements are due in OAA-SYS, which is our reimbursement software, which I mentioned earlier. It's due on the 15th of the month for the previous month. It's due at the same time that everything is also due in PeerPlace, the database system. So you're entering in all of the information to say, these are all the people we served, providing these services, and here's our reimbursement request, and both of them match. So on the 15th of January, all of the information and the reimbursement request for December will be due. Background checks are required for all staff and volunteers that have one-on-one contact with older adults for the service that you are providing. If you are a provider, you are only contracting with us for transportation, but you also provide a falls balance class, but I'm not paying you for that. You don't necessarily have to have a background check for services that I am not paying you for. It's definitely a best practice, but anybody with one-on-one service, one-on-one contact with an older adult for a service that we are paying you for, they have to have at a minimum a CBI background check. This is a big thing from the state. They will always, I will always ask, and they will always ask to verify that you've done CBI background checks on those people with one-on-one contacts. There is also something called a CAPS background check, which is the Colorado Adult Protection Service. It is a separate background check from the CBI check. You must create your own policy that identifies which employees provide direct care to an at-risk adult. Once you have that policy, then that's how you'll decide who gets the background check. Volunteers never, ever get a CAPS background check, even if they have one-on-one contact. They will always get a CBI background check. CAPS background checks don't take the place of the required CBI background check. It just would be in addition to. Two more things. You have to have this done before you hire, before a new employee starts working, and you also have to get that written authorization. There is a form. You should have a copy of it. If you don't, I can send you the most up-to-date one. You can also get it on the CAPS background check website. You have to have that written authorization form from the prospective employee, and then you use that information to run the background check. This is not an exhaustive list of all the paperwork and documentation that you are required to have to be one of our contractors. There may be additional requirements based on service. This is a good general list. I'm not going to read it. Required insurance is another big thing with contracting with us and thus contracting with the state. You have to name the COG. Vintage is not, and we are a department of the COG. I am not, and I don't have any kind of legal authority outside of the COG. So the COG has to be named as an additional insured on all of your insurance policies. This is a list of all the required insurance. Again, I'm not going to read it. This is just hopefully a good reference tool for you for the future. I'm going to say, especially for any individual who is contracting with us, and I'm going to say a registered dietitian and RD at this point, because so far, the only individuals who have contracted with us have been RDs. Depending on a few things, you might not have to have all of these insurances or to this level. It depends, and that's why I'm going to say that would be a conversation. But in general, these are the required insurance policies that you have to have with us as the written within that insurance policy. The one thing that an individual does have to have that a government agency or a nonprofit agency doesn't have to have is this professional liability insurance. But I just, for example, an RD may not have to have auto liability, or their personal auto liability can meet this requirement. It just is something we have to talk to the state contract person about. So don't get too afraid of this.
We have a few questions.
Okay, ready.
Chad is wondering if he thinks he knows the answer, but for the CAPS background check, what is considered an at-risk older adult?
An at-risk older adult would be how the state defines it. The mandatory reporting requirements. So over 60 or somebody with an intellectual or developmental disability.
And I just,
Or you, within your own policy, you can define that. But I think the minimum standard would be the mandatory reporter standard.
I just realized I probably shouldn't have mentioned who that was. We have two other, follow-up is, so anyone over 60 is considered at risk, question mark.
The state defines an at-risk adult as over the age of 70 or older.
And then we have another question. Will we send the recording link out? Yes, that will be going out. And when is the new provider training? That will be before contracting goes out, but after probably contracts are determined.
Yes, and I have a slide on the timeline of what all that looks like. And so we can talk about that. I also want to say, just because we were calling it new provider training doesn't mean that it isn't open to everyone. If you're a current provider, but you have new employees, that would be a great example of somebody that you may want to attend. And the recording will be posted on our website. So I wasn't intending on emailing it unless we hear from y'all that you want that link also emailed to everybody who registered for this. Otherwise, we were just going to put the link on our website where all the other RFP information is.
Then we have two more questions rolling in. If we have staff already, do we run the CAPS background check on them in order to be contracted? And can we apply for other services such as chore?
Will you read the employee question again?
If an organization already has staff, do they need to go back and run a CAPS check on them in order to be contracted with us?
Yes, I guess I feel like I might need to say between current providers and new providers. So if you are a current provider, so oh man, I can't remember exactly what year this went into effect. 2019, I think, January 2019. So if you had staff who you were already contracting with us, and that person had been hired prior to when the CAPS background check requirement started on January 1st, 2019, then no, you did not need, it wasn't retroactive on current staff. If you hired new staff who then were providing services that you contracted with us to provide after that January 1st, 2019, then yes, anybody new needed to have a CAPS background check. I think that answers the question for current providers, or maybe if you had a staff who started working prior to 2019, but maybe was in a different department and moved over to aging services, or maybe they were in HR and then started working, at the meal site.
Guess if a new provider.
Oh, okay. I'm sorry. New providers, yes. Anybody providing, any of your employees who are providing services to one-on-one services, yeah. And I honestly, like, if you would even question it, I'd just do it. I think it's a best practice, and then you really have to worry about it. It's not normally more than a handful of staff because it doesn't apply to volunteers. You have to get registered in the CAPS system to be able to do it. And it's been so long, I actually need to double check I feel like maybe we have to tell the state that you are one of our providers. I can't remember that actually. That will be on the new provider training. There was another question about services. Yes, if there is a list that we're going to go through of all the services that you can apply for during this RFP. You could apply for any of them. More questions? Okay. Regional Advisory Committee. This is our voluntary group of community members and at least 50% older adults who provide guidance for us as the Area Agency on Aging and advocate for the aging services, the aging network within the state, and even potentially at a national level. They are required within the Older Americans Act. We have a RAC. Right now, it is made up of both service providers and older adults. The thing that we probably need to be most cognizant of, though, it has to be at least 50% older adults. So it couldn't just ultimately end up being just all of our service providers on the RAC. Hasn't been a problem. Two things that make the RAC important to this conversation with the RFP. There is a group of individuals from the RAC who then make up a subcommittee of the grant review committee. So what's going to happen is after the RFP closes, we will take all the proposals, we will put them in a pretty package, we will review them, we will make recommendations to the RAC, we will send it to the RAC, they're going to read all the proposals, they're going to read our recommendations, and then we're all going to get together on March 13th. I think so. I have to look at it's on our timeline. And we are going to talk about all of it, and the RAC is going to say, here are the proposals that we would like to approve and for this amount of funding. So this committee, a subcommittee of the RAC, plays a big role in this RFP process. They also play a role in the 4-year area plan and ultimately have to sign off on it before we submit it to the state. The RAC meets 4 times a year. This year, those are the months that we are meeting. That is generally when we meet. We try to, in the past, we've done January and November's meetings virtually, and June and September in person. COVID, well, I'm not quite sure what we're going to do this year. We'd love to be able to do June and or September's meeting at least hybrid in person, and for those who can't or don't want to attend in person, there could be a Zoom. I've given up trying to figure out what's going to happen in the future. But that is what it looks like for 2022. Hopefully we can have at least one hybrid meeting. Let's get into all of the services that you can write for on this RFP. Adult daycare is a registered service with reassessment requirement. There are a few services that have additional eligibility. Probably should have gone over this first. To be eligible for any AAA service, it is only an age requirement. So as long as you are at least 60 years old, you are eligible. It is not means tested. It cannot be means tested. It doesn't matter if you make $100 a year or $100,000 a year. If you are over 60 and you live within Region 12, you are eligible for an Area Agency on Aging service. And as a provider, you have those same requirements. Some services have a few additional eligibility requirements. That is adult days. You have to have at least 2 ADLs, activity of daily living. You can't do at least 2 activities of daily living, and or you have a cognitive impairment. And then at the bottom of all of these, it's going to say what a unit is. So 1 unit, which is what you will put into the peer play system, is 1 day, but you can have fractions of a day. Case management, also a registered service, also reassessments. This one doesn't have additional requirements for the client, but it's the only service that has additional requirements for the case managers. You do have to meet, a case manager has to meet certain educational or work experience guidelines. It is spelled out in the policy and procedure manual. Case records must contain certain elements also spelled out in the P&P. Chore, also a registered service, also has 6-month reassessments. The difference between a chore and homemaker, which is not something that you can write for in this RFP, we provide homemaker services internally as a voucher. Homemaker is something you are coming regularly into a person's house and doing laundry or vacuuming or meal prep or whatever it is. Chores are one-time, seasonal, or occasional in nature. So that's getting snow off somebody's roof or raking leaves or turning mattresses, something like that. Also, additional eligibility, basically the person can't do that chore for any number of reasons. Reassurance is a registered service. It's just contacting an older adult on a regular basis. Caregiver support groups. There are 2 people in the caregiver world who have to have an assessment. The caregiver, which only is a requirement to have 1 assessment at the time that they start attending the support group, and the care recipient, who gets one of those reassessments every 6 months. The person whose age we care about for eligibility purposes is the care recipient, not the caregiver. So you could have a 30-year-old caregiver providing care for her 60-year-old mom, totally works. Congregate meals. This is, if you are a congregate meal provider, a long list that is not all inclusive of all the things that you have to do or document as a nutrition provider. Bless you. Thank you for doing this day after day, month after month, year after year. I'm not going to spend time going through this. There's a couple weird things, or I shouldn't say weird things, additional things about the nutrition program that other services don't have. You can have a guest come to your meal site. They have to pay, unlike all of our other services where all you can do is give somebody the opportunity to voluntarily donate. But if you are under 60 and you go to a meal site, you got to pay that $14. You have a lot of trainings you have to provide to staff, volunteers, and clients, a lot of paperwork. It is our service that has the most policies and procedures around it. Home delivered meals is exactly the same way. I guess I'd say the biggest difference is if you go to a meal site, you just have that one initial assessment form. If you are receiving home delivered meals, they do have the 6-month reassessment requirement. A lot of the stuff is still the same. Still have to do temp logs, still have to go through the RD if you are changing the menu in any way. Still have to offer nutrition education, although nutrition education for home delivered looks different than it does for congregate meals. Amanda, you have your hand raised.
Quick question for you. With chore services, does the person doing the chore need to be contracted or licensed?
I'm going to make an assumption that the person doing the chore is not going to be the contractor of our services, that there is an entity that is contracted with us, and that entity then has staff and or volunteers who are actually providing the chore. So I do not have requirements on I'm not sure what kind of licensure that person would have. your organization may have requirements, but there's nothing in the P&P that says a person providing chore has to have a certain certification. There are things and there are requirements in the P&P for people providing personal care and homemaker services, but we provide those internally through a consumer directed voucher, which don't have those same requirements. I think I might have gotten way too in the weeds for that. To answer your question, no, people providing chore don't have to have a certain license.
We have a follow-up question about independent cleaning people, businesses of one. And I was just going to further iterate that as a voucher, we run some of these programs as a consumer directed voucher where anyone can provide that service. But I think you reiterated what would it look like from a contractor level.
And also, to me, the flag that stood up with that was, as a subcontractor, that sounds like a provider subcontracting that out again, which you can't do, at least without having a big conversation with me about it on exactly what that looks like. Because then we're like, okay, well, does that person have to have all the insurance requirements? So it sounds like, just based off of that very brief question, that it could be, we're going to get the chore contract and then we're going to subcontract to an independent contractor to provide the service, which you can't do generally. Material aid food is a registered service, but it doesn't have all of those regular nutrition requirements that you do with home delivered and congregate meals. An example of two providers who currently have the material aid food service in their contract is restaurant vouchers, and then like a basket of fresh fruits and vegetables, dairy items, non-perishable items. Registered dietitian. So like case management, this is a service where the person providing the service has a big laundry list of items, certifications, education requirements that you have to meet to contract with us as an RD, the registered dietitian. I'm not going to read these, but I think I have 2, maybe 3 slides of all of those requirements. So they start here. You have to have BA, you have to be licensed, you have to have 900 supervised hours, you have to have completed the exam, and then you have a continuing ed requirement. I kind of struggled on how to, for any RD who was going to respond to this, to let them know what they are responsible for. So I decided to go with what the current nutrition programs are now. This could be different on July 1st if one or all of our nutrition providers don't submit a proposal. So this is what it looks like right now. We have 3 meal sites in Eagle County. They also do home delivered meals. We have 1 meal site in Pitkin. They also do home delivered meals. And we have 1 meal site in Grand County. The nutrition consultation is the menu analysis, and it is what you use Food Pro, that I have never been in before in my life, so I don't know what it's like. I have heard from our RDs and from the state RD, Leanna, that our Food Pro is a mess. I don't know what that means, but I just want to be real transparent. I also know from our current RD that our nutrition providers do ask for a lot of substitutions. So I think that there's a lot of meal sites in the state that once a menu is in Food Pro, they repeat that menu every month, every quarter. I don't know. But our nutrition providers like a lot of variety in their menus. So they may say, well, this month we're going to do lasagna, but instead of Brussels on the side, we're going to do broccoli, and instead of a Caesar salad, we're going to do a garden salad. So the menus do require a lot of substitution, and basically, as far as I understand it, a reanalyzing the meal. So want to just be really transparent that I think that that's why RDs in our region, even though we don't have a ton of meal sites, it is pretty analyzation heavy because there's a lot of subs. Nutrition counseling is available to anybody over the age of 60 in any county and any registered caregiver, even if they don't go to a meal site. So it's been awesome. I've seen some of our case managers in the past 6 months say, I have a client who's interested in nutrition counseling. I think that's so awesome. That person might not be going to any of our meal sites. So nutrition counseling has not been happening in person. It's all been happening over the phone or a Zoom webinar. And then nutrition education is similar to counseling in the way that anybody could ask for education. So we don't pay Summit County to provide congregate meals, but they could request a presentation. Again, it's been a little bit janky because of COVID, that none of this has been in person. In the future, I would love for it to be in person, that we're just not there yet. So in the past couple of years, it has been a live Zoom presentation that we also record. There is a difference currently between nutrition education for congregate and nutrition education for home delivered. Home delivered is still the old way of doing things, which is the nutrition providers provide monthly some kind of written education, and it has to be either written by or approved by an RD. And nutrition education for congregate is very different now. All of the details, and there are a lot of details, are in the policy and procedure. Some of the big things to pull out are, it has to be evidence informed. The presentations can be in person, but they can't be during the meal because that is a captive audience. You can also do classes. An example of that is Cooking Matters, which actually doesn't have to be run by an RD. And one unit is one contact. This is some of the stuff that I've already talked about. This is what our current RD said would be helpful information for a new RD. She's spending 20 to 40 hours a month on our contract. Most of that is, almost all of it is menu analysis. You got to get in Food Pro. The RD will work closely with the nutrition providers for all the menu analysis, and then you'll work closely with us. We'll figure out what to do with assessments, how we want that to work, if you even need to put that into the database or if we do that for you, and making sure that we are meeting those education requirements. So you'll meet with me, we'll figure out how we're gonna meet, we'll be in compliance with education presentations. Transportation is a registered service. For a little while at the beginning of COVID, they were letting transportation be transporting of an item because nobody was really going anywhere, but transportation providers could pick up toilet paper or groceries and deliver it. They don't allow that anymore. So now it's back to transportation is transporting a human. Information and assistance, not a registered service. It's one-on-one contact. Legal assistance, it's not a registered service. It's legal advice by an attorney to older adults with economic and social needs. Public information is aggregate. The biggest difference between information and referral and public information is that INA or that INR, information referral, is one-on-one. Doesn't have to be in person, but it's, I'm responding to an email, I'm talking to somebody on the phone, I'm talking to somebody at a meal site. Public information is kind of like big broadcasted. Most entities who have a service with us for public information use it to help pay for their newsletters. Just use it to help pay for marketing in general. Evidence-based disease prevention and health promotion. It is a registered service. It has a huge, to be able to provide this service, you have to be able to provide an evidence-based health promotion class or service that meets the highest tier as defined by the feds, basically. This is a link of the evidence-based programs that are allowable. Here's the timeline. So the RFP is going to open after the proposers conference. After the proposers conference, we will go into a quiet period where I will answer your question, but I will post it for everyone to be able to read. I had something to say about that. I don't remember what it is. The RFP closes a minute before midnight on February 2nd. Amanda's going to go into some best practices as far as making sure that you get it in by the due date. Then on March 11th, the RAC Grant Review Committee will review it. Then we take those recommendations, submit it to our COG board for their final approval. Then you will receive a letter of intent or denial. And we will also submit everything to the state with a subcontractor approval form. The state does have to approve all of the contracts. Then in May, we will send the contracts to y'all for a signature. We know that some of you have a really long process to get a contract signed. You got to get on the Board of Commissioners meetings, et cetera, et cetera. We try and give you as much time as possible. I think last RFP, we changed the contracts to basically mirror what our contract is with the state, which makes them big and onerous. And unless you have a law degree, hard to understand. I don't see there being a lot of change at all with this contract with the ones, if you are a current provider, the one that you have right now. But if you get it, you're a new provider and you get it and you're like, oh, sweet baby Jesus, this thing is ugly and big. It is because it is what our contract is with the state. So if you are one of those people who wants to read it, I would recommend starting that early. We need to have all contracts fully executed by June 15th because 2 weeks later, those new contracts begin and you cannot provide a service until we have a fully executed contract. These are going to be a little bit different from current contracts. Right now, if you're a current provider, you know that we basically have a 1 6-month contract with 3 6-month option letters. It's been kind of painful. We do have a really good reason why we did it that way. And I will speak to that on the last 2 bullets. We are trying to simplify and hope that it works by doing a 1-year contract with a 1-year option letter. So the time is still the same, it's still 2 months, but not so much rigmarole with option letters every 6 months. They will be from this July until June 30th, 2024. There's 2 reasons why we went to that 6-month contracting. The first was that starting a few years ago, funding from the feds and the state has been super delayed. So for example, carryover, which is any funding that we did not expend within our regular contract period with the state, then becomes carryover. So theoretically, if our new contract year begins July 1st, we would like to expect carryover in August or September. we don't get carryover until February. So it means we can have some really lean months starting about now, and especially January, because we are still paying providers and the expenses that it takes for us to run our programs internally and staff. And we basically don't have the money yet from the state. We still don't have our ARPA stimulus funds. So we hoped that having 6-month contracts would do two things. It would allow us to be a little bit more flexible when funding gets really delayed and the state's like, sorry, we don't really know when we're going to get it. And it was going to help with some of the front loading issues. If you front load your contract, you know what I'm talking about. If you don't, I would prefer that you don't start doing it. But, and there's nothing that says that you can't do it, but I'm going to tell you that if you front load your contract, meaning if you've got a $20,000 contract and you ask for $10,000 in month 2 and $10,000 in month 1 and $10,000 in month 2, and you expend your contract at the beginning of the contract period, it does make it more difficult for us while we're waiting for the funding from the state and federal government. We haven't said you can't do it, but just know that that is part of the reason why we thought maybe 6-month contracts would help. It is what it is, and we've been able to make it work, and we understand why some contractors do that, but it can create a funding crunch for us when we are waiting for funding. Just because we are doing 1-year contracts doesn't mean we can't do amendments. I do them at during every 2-year contract. If you want to add a service, if you want to reduce a service, if you want to reduce funding or add funding, those are all things that we can talk about, and amendments are possible. Okay. This is where you can find all of this information. I am going to navigate here. So you're going to be able to find the proposer's guide. This is where you're going to find the Q&A, the service definition. So all those individual slides that talk about specific services, the state definition in very small font will be in the service definitions. You'll be able to find a link to the PNP and the volume 10. You'll be able to find these conference slides. It is one document. All of my slides are at the beginning. All of Amanda's slides are at the end. And then once we have it up today or tomorrow, we'll put this recording. So I'm going to stop share, and then I'm going to share a new website just so you can see where to go. You're going to go to our website, which is Your Vintage. Most of the links are going to take you specifically to the professionals providers portion of this. But in case you ever try and navigate there, it's not, because our website is meant more for older adults and caregivers, it's not quite as easy to find where you would go as a provider. Here's the easiest way to get there. Go to the homepage, scroll all the way down to the bottom, go to For Professionals. And here, Amanda, give me a thumbs up to make sure you can see the, okay. Scroll down. Here's the stuff about the RFP. So these are all links. You'll find the proposer's guide here, service definitions. After this is over and we have the video of this ready to go, this is going to change from conference registration to conference presentation or video recording, whatever. You'll be able to find this video there. Slides are already here. This is where you'll find answers to questions asked during quiet period. And then this is the announcement, which you all have, I think. And also the link to actually getting into the RFP site, but Amanda will go into that, but you can find that there too. And then the last slide is this one, which is my contact information and the elevator pitch of what we do. Any questions before I give it over to Amanda? I see your hand, Chad.
I don't know if I was allowed to actually say something, but besides typing questions. But another question I have, and maybe I struggle with this because I have, you know, 2 really large programs of car and get and home delivered meals compared to maybe some other providers on the call. But, you know, one piece I struggle with is within the RFP process, you know, my total expenditures for a program far exceeds, you know, what I ask for. And so I guess my question is, you know, advice or perspective on what percentage of my total cost should I be asking for? Or should I just kind of pick a random number and hope it gets close to it? I have historically, you know, tried to look at a percentage, knowing if I ask for 100%, you'll just laugh at me and say no.
I will use that as an opportunity to say that we don't fund anybody at 100%. AAAs don't do that. So just as you are considering how much, I know you know that, Chad. But
I know that.
Yeah, I know.
But you know, trying to think about, you know, as you know, I think all of us have, you know, these last 2 years have been a struggle for providers and for funding. With everything being tight and opera funds being told for 2 years they're coming and they're still not here yet. And it doesn't mean they're going to get to us necessarily. You know, so just thinking about what is an appropriate type of, you know, mechanism to try to determine, should I ask for 20% of the actual cost, 30%, 50%, 5%, you know, particularly given, you know, local, for probably Betty providers, you know, the different funds and having to answer to our powers that be of why would I go through all this work for 5% of the total cost of my program, just to be really blunt, for example.
Well, I mean, yes, and we already have 12 providers. And so then we are getting additional funding for route. So it's not like we'll have to provide services to route without funding from route, but with addition of hopefully route providers, we already have 12. You know, we have a very limited amount of funding. So let's say it costs $400,000 to run the congregate meal and home delivered meal program, because I'm not saying that it does. I'm just saying that because I know it's a very expensive program to run. And I also know that food costs and personnel costs have only increased. But if my funding as a AAA to provide internal services and provide services in 6 counties is only $1 million, I am capped at, even if that is only 5% of the cost of running your program, I have a very limited budget as well, because we are third smallest AAA region in the state. So it might be to tell the powers that be. I mean, I have a couple of thoughts about that. So let me try to finish this train of thought though. It may be a smaller percentage of funding that we can provide for your services, because you just happen to provide services that are very costly to provide. But at some point, I can only say I can't have one provider that's taking 50% of the entire region's funding. I know I'm speaking to the choir. So I think that, I mean, and if that is, you need an honest idea of how much funding your AAA has for the whole region, that might help your commissioners understand, okay, well, that's why, you know, you can never get more than $100,000 or whatever it is. I also would use this as an advocacy tool, because cities and towns are getting a lot of money from stimulus funding, and use this as an opportunity to say, great, we know that as a county official, you need to put more money into school systems and to infrastructure and blah, blah, blah. But how about your local senior or older adult service provider getting a share of that stimulus funding as well, because they are an integral part of our community, all the reframing, aging, all the things. So I use this as an opportunity to say, hey, some of the stimulus funding should come to provide these services well, because our local AAA can't fund all the services at 100%. And I think I saw Amanda write something in there, which is probably really all you wanted to know. Something about 50%. In the past, it's been about 50% of the total cost of providing service, which could have been a real short answer to your question, but I needed to get on the soapbox a little bit. And to know that
soapbox, so it's all good.
I guess the other thing, just as a general statement about how do you decide what to request, I'd say it in two things. I've always told people, be aspirational. And I find that a lot of times people are. And what's going to happen if you ask for $400,000, Chad, I'm going to say, I really appreciate you shooting for the stars. I can give you 80, but at least you didn't ask for 60 and I could have given you 80. So, that's what I would tell everybody, shoot for the stars. And in the same way, we have additional funding from stimulus that is not going to last forever. We also all know that, but we will give you as much money as we can and what is reasonable. And that's the other thing that I would say. When you are deciding how much money to ask for, we're going to look at a couple things. Even though we don't reimburse at a per unit rate, we do reimburse at actual cost. If we're still going to figure out what your unit rate really is. So if you're saying it costs $400 to provide a meal, I'm going to say that's unreasonable. And you either need to ask for less money or say you're going to provide those services to a lot more people. So be aspirational and then also be reasonable and figure out what you really think that per unit rate is and kind of frame your request around then. More questions?
I ask one more thing.
Yeah.
I'm sorry.
Anybody
can cut me off. But, I also think it's important to realize that, for the most part, we look at our data from previous years for the RFP, but we're looking at 2 years that mean nothing. So, I'm curious how, if able, the RFP committee can take in consideration of 2 years of almost useless data as far as projecting the future.
And that is a reason why we make recommendations to the RFP committee, because we, even in addition to 2 years of useless data and 2 years of forecasting into the future, forecasting what? Like, this summer, I didn't think that we were going to be in the middle of the biggest surge again that we've ever been in. I was really optimistic. Hey, we've got vaccinations. This will be great. So I've stopped trying to forecast that. And that is a discussion that we will have with the RAC committee to say, we are cognizant that if you were a transportation provider 2 years ago and you said that you were going to provide 1,000 rides and you provided 300, that we're going to assume that the reason was because of COVID, and we're going to take that into consideration. There was another point that I had about that. Oh, additional information that we have, which is why we make recommendations to the RAC, is we can say, listen, this has been a star provider. They get everything into us on time. It's right. You know, they're checking all the boxes with compliance, you know, and so we trust that they will efficiently, effectively, appropriately provide this funding, barring any more, you know, pandemics or national disasters. We also, on the flip side, can say, we really struggle with data with this provider, they're always late, et cetera, et cetera. And that factors into it too, very honestly. So, you know, it's more than just, I guess what I'm trying to summarize and say is that we get it, we understand it. That's also why we can make amendments in the middle of this. If it's just something out of our control happens, we know there's staff changes. I mean, stuff happens. We understand that because we fall into that as a provider ourselves. We fall into that same thing. And for current providers, we do have a much longer history of data, Pitkin County Senior Services included. And then we also have just like, as a provider, you basically doing all the things you need to do to contract with us. More questions? I literally told Amanda yesterday when we were kind of going through all this, I was like, oh, this, my part won't take an hour. So I appreciate, I guess I just didn't realize how much I talk. Okay. I think it's you. And I'll do the same thing for you, man. I'll monitor the chat and I'll interrupt you if you need to.
Okay, just a second here while I switch over. Okay, is it showing my introductory screen? Okay, I don't use PowerPoint much for this, and so here we go. Okay, so I am going to discuss how to actually submit the proposal into our OAA-SYS system. OAA-SYS is Older American Act system, and that is what we use. Thanks, Chad, I needed that. For our reimbursements, we use it for our RFP, and we also use it internally for tracking. It should be, it's the same system we have used for several years. However, the RFP module for it is we haven't used for 2 years. So there's always a little bit of a learning curve and getting comfortable back in the system again. So we've been working on that. That said, there will be some slides in this slideshow that have Alpine Area Agency on Aging in the screenshots. And that is because the test environment that I was using was older and still had the original name in it. So we're just going to walk through OAA-SYS. We're going to walk through registering and logging in, all the ways you'll enter the proposals, do the budget, and validation, as well as how to submit it. Registration. Everybody, agency and applicant has to re-register for the RFP system. Your current login for OAA-SYS will not work. It does require starting from scratch and pretending that you've never done this before. To keep things as simple as possible, we have created 3 different RFPs, and they are all open at the same time. One is for new providers. In the drop down, there is one for registered dietitian and one for current providers. Part of the reason we separated things out this time was we were finding that there are questions that are not necessarily representative of every different population. And, you know, we don't need to know when your agency was initiated if we've been contracting with you for 30 years. And it kind of gives new providers a chance to let us get to know you and figure out kind of almost that first date meet and greet opportunity. So, and questions for registered dietitian is very different than questions necessarily for transportation. So please select the correct one from the drop down. And it looks like we have a question. Erin.
I have a question, and then it looks like there's another question in the chat. I'm going to say this, it's going to sound obvious. I just feel like I need to say it. A current provider is if you are one of the 12 entities that is currently providing with us right now, the RDs. And then a new provider is if you either have never contracted with a AAA, or our AAA is really what matters, or even if you are a current AAA provider in Region 11, you still would be a new provider for us. I know that's obvious. I just wanted to say that out loud. Let me ask a question. Okay. Everyone has to re-register for the RFP portal component. To clarify, that includes providers that already have a login from the RFP portal from 2 years ago. Yes, that also includes providers that already have an OASYS reimbursement login. It is a different part of Chocolate Software who does OASYS. So even if you have a RFP login from 2 years ago, you're still going to get a new login. And if you were already a current provider and putting in your reimbursement request monthly into OASYS, it's still a new and different login.
Yeah, and I just want to agree, if you still have that login from 2 years ago, you are a shining star because I certainly didn't. But everyone will need to create a new one and start over again. Okay, so here is the link to where the RFP resides, the URL. It is also on our website. Yep, there's where the drop down is. When you first log in on the URL, there will be 3 different additional hyperlinks. The top one is where you can print out and read the entire RFP proposal, a lot of the required readings, what it all looks like, the services available. You certainly don't have to because it's also within the proposal. Go ahead and ignore number 2. You're clearly here at the conference, so you don't need to register. So you will be starting at number 3. Go ahead and click there. And this is for everybody, and this is initially for the agency. Okay, so each person must belong to a registered agency, and whoever sets up the first agency will get a code that they will need to share with everybody else in their agency. Like if let's say transportation, one employee does that RFP, and meals, somebody else does that RFP. Everybody will need the same agency code so it can all come together under the agency RFP. Once you have the code, and I believe it comes in an email and it also will show up on the screen, you can copy paste the agency code and hit submit. Once you do that, here's all the terms and conditions. Agree to those, submit. As you're registering your agency, name of the agency, we require an email address, and you certify that you are part of the agency.
And Amanda, what happens if you are an individual and not part of an agency? How should you do that?
Thank you. If you are an individual not part of the agency, your agency is you. Go ahead and put in your name for the agency. And you. Here's where it looks like that agency code is. I'm not sure how my slide got out of order, but copy paste, put that in there, and we're good. Also, a reminder to write it down, give it to your friends and coworkers. About the only time I've ever said that. Here's where you'll put your name and register for your own login profile. You certify you're part of that. Yes, yes. Okay, this screen can be a little challenging. There is required reading in order to submit an RFP for our agency. It looks like there isn't anywhere to go, and the box is grayed out here and agree. You must go through and enter each one of these links and read the information, and then it will allow you to certify that you have done the required reading. So open that up, read it, and once I went through all of these, you can see the check boxes are there. This opens up and you can say, I agree. This brings you into kind of your agency homepage. This shows all, this allows you to create the proposal and put each of the services and under it as such. So create proposal. You can see that you are logged in as yourself. Here is your agency and here is the login. Creating a proposal. Pretty much if you see an edit, there is stuff that needs to be completed inside that space. So we are creating one giant agency proposal and we are going to click edit. The proposal description comes up. It gives you an opportunity to tell us a little bit about your agency as well, and what you're planning to submit. It does not have to be, we have no word. I don't believe we have a word limit, but it does not have to be a Russian novel. Just enter in whatever you take to get through it. So once you complete your description, you will hit next. It brings you to where you can start adding services. You will need to add a service for each, a service record for each service you are wishing to request. So there is a drop down as well as the service definitions. They will describe everything that you need to know about that service, what is included in that service, what the units are, and how it's reported. So that information is there. You'll select your service and click Add Now. For this proposal, we are submitting a congregate meals service, and you'll see that there are 4 edits that showed up on the bottom. Every service requires each of those edits to be completed for each service. When you click on the first service edit, congregate meals pops up, and you can provide the detailed description for congregate meals. And that's pretty cut and dry. Once you complete that edit, you'll click on Edit under Budget, where you will request state and federal funding. This is a reminder, this is a 1-year contract that we're looking at with a 1-year option letter. We're no longer doing 6-month contracts. Don't worry about that. Put in this amount as what you are requesting from Vintage in state and federal funding. Basically, this is how much you want for us for a year. You will see over here, this is the budget tracker. It lets you know what you've requested, how much additional funding and revenues will be provided, and what your expenditures are. The budget, the revenues and expenditures at the end of the request have to balance out. We realize that there's probably a lot more funding that may go into match than what you're requesting, or than you're able to request, because the revenues and expenditures have to match. So it can be kind of a little bit quirky that way. Right now, I have 0 requested and everything matches. This is green. When I go to next, I requested $500,000. And you can see it says that up here. This little box says, right now, you have not identified any of the match that is required to be included with that amount of money. And my expenses don't match because there aren't any. For match, there is a 10% match requirement for our funding. And it's this weird formula of how you get the 10% match. It's not that you type in 10% of $500,000 and here you go. It includes, it's my understanding, it includes the match amount to determine the match amount. So what's great for us, we don't have to do the brain damage. You can get there, calculate the match easily by dividing the amount you're requesting by 9, or the system just does it for you. There's also a couple of websites that I use a lot for that. And everything is 10% match except for caregiver support groups, which are at a 25% match, since our caregiver funding requires a higher match as well to the state. So when you hit next, that previous screen is all about match. I'm sorry, I can go further into that. Match includes either local cash, which is additional funding that is not federal funding that helps pay for that service, or an in-kind donation. In-kind can be the rate of my rent counts as in-kind up to whatever percentage of time you spend there. In-kind can also be donated equipment, donated items. It just needs to be documented. So, but this screen here does not include other forms of revenues that may be coming into the program, like program income, guest fees, and guest fee, what's the word? Subsidies. When you hit next, it brings up the other revenue screen of the budget. This is where you can include your estimated program income, estimated guest fees, and guest fee subsidies. You can see that the match I entered was the 9% or 10% match, but my revenues do not match my expenditures just yet. As you add, you can add multiple items with each add revenue source. So you can have like up to 3 or something, or 5. Then you hit next. The next screen is about the personal expenses. You can include personnel for both salaried and hourly employees. Salaried, you can put in the annual and say 2% or use a percentage of the salary towards this program. You can also do hourly, where you put in the hourly rate, estimated hours, and it will calculate the total for you. It adds it up and enters it over here at 51.6, still does not match. So then the next screen, as you hit next, is your program expenses. This is where you can enter in your food, enter in supplies, office supplies. There's not a whole lot of description in the expense type. We wanted to keep it very broad. So just food, which we know is really essential to a nutrition program, isn't in the drop down. It's considered an other expense, and you can just type in food because that's easier for everyone. You can see that once I added in the food, that program expense plus the personnel matched what I was requesting with the local cash, with the other revenues. We have a match, we have a green light, everybody's happy. Go ahead and hit done. The next edit for this service is units and clients. There, in this dropdown, there are options for each of the counties as well as region-wide, as we have some services that would be region-wide, like RD and legal assistance. This is also where you will enter in the amount of units that you expect to provide for that amount of funding. We do, because the state looks at that, look at how much it costs per unit to provide the service. However, we reimburse actual costs that are submitted to us, not on a unit-based reimbursement. But it is something we examine to make sure we're in range with the rest of the state. The next field is total and targeted client counts. This is how many people you are expecting to serve with these units. It also provides information on how, if you need to target, how many of the special population groups you feel you can meet. And as a reminder, eligibility for OAA services, you are not allowed to means test and approve someone based on income. However, if you are on a wait list, low income individuals are prioritized along with the special populations for receiving services from that wait list. There is, after you go through the description, the services, your budget, next opens up the narrative. There are, I don't think, like 5, 8 questions maybe. Shouldn't be hopefully too painful. It does a count of your number of words. I believe it has spell check. My biggest advice, no matter what you do, save. The system will time out while you're typing. And when you get to the end of it, you can lose it because you have to log back in. One of the easier ways to handle the narrative questions is to just go ahead, take the questions, type it out in your word processor. Then you don't have to worry about saving consistently to keep it from timing out. And then you can copy paste it into the narrative. It does make the formatting a little wonky, but we understand that, so don't stress too much over formatting. Beneath that, once you complete the narrative questions, it does require you to complete the federal employee FEIN number. It's a little temperamental about the way you enter the number. You'll need to enter the slashes and have the correct number of X's. I fought with that like 3 times, but it's doable, and it will accept it. Other statuses and organizational types enter as applicable. From this, you will move on to the contact information. The RFP does require that each of these roles be submitted for the proposal for the contact. And if you are a agency of one, mighty and strong, you can have one person fill all of those roles. So when you hit edit, put in the correct contact for each of those designations. After contact information, it's exciting. You've made it through all of these items. You think you're ready to finalize. It will always take you longer than you think it will, even after this point. Because immediately at that point, you will have to validate your reimbursement, and it runs against some coding and language out there to see if there are any errors, information that wasn't entered in the manner that the RFP is requiring. I went back and changed the budget on this proposal to not match revenues and expenditures, and it came up with an error. If there is an error, it will not let you submit the RFP until those errors are corrected. I also went back and pulled out one of the designations, contact designations right here. I pulled out program manager, and it came back and said, yep, no, you're not going anywhere. It does make it a little easier because some people are going to have multiple services, and everything balances in congregate meals and home delivered, but transportation is off. If you click on this box here, it will go to a drop down of which ones aren't adding up correctly. And if you click on it, it will take you directly to where that error is. You click on it. Oh yeah, I had to change this. Now my revenues and expenditures match. We're good. Save it, go to home. And then you have to revalidate your proposal. And yay, we did everything right. It's green, life is good. Even from this point, it will take a lot longer to get submitted because the submission process involves a PIN number that has to be emailed to you. Which brings us to this screen. Yay, your proposal's ready to submit, request a PIN. Yeah, I am not a particularly patient person, so this is a really hard step for me. You will request a PIN and it will come into your email. The problem is it takes anywhere from like 2 minutes to 5 to 10 minutes for that PIN to come. So, don't do this at 11:58 on the day you're submitting. The other thing that happens is you hit the button and you don't know that it knows that you hit the button. So you hit it again and you hit it again. Every time it creates a new PIN, it invalidates the previous PIN. So click the button and just sit and wait for a few. Because yeah, I even just filling out this proposal, I invalidated 2 of them. So hit the button, then just check your email. Once you have the email, this is what the email looks like. Again, it says Alpine A because this was a test environment. It pops up the proposal number. You will take that and drop it into, this is the screen from here. Already have your PIN, click submit proposal. They want to know who signed it, what your title was, put in your email and drop in the PIN right here. Once you enter in the PIN, your entire proposal is read only. So if you are working on a proposal with other individuals in your office, don't submit the entire proposal until everybody is done with their part, or the proposal will be submitted and no one else will be allowed back in to complete their portions of the services and proposals. So this is only after the entire agency proposal is ready to go. Once that occurs, you will get the pop-up on the screen that says, yay, thank you, you've submitted it. And you will also get an email. And I ran through that pretty fast. So if there are any questions, let me know. So yeah. Oh, thanks, Ken. I was like,
typical.
You can always count on me and asking a question. This is more of a hypothetical question, so it's not super like related to all this. Thank you for going over all this. It's helpful since we do it every 2 years or so. Is there like more, again, hypothetical, like in the future, a opportunity to maybe have a kind of a joint RFP, say if multiple agencies wanted to, like, let's change the world in a very innovative way and have one giant RFP for, say, a region, for example, instead of one provider or something. What do you think about that?
absolutely. I think it would be, the agency would be regional, da 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 da. And then each like different county could submit their portion of it together as region wide. And we do have some services that are region wide, so it is set up to accept that. You would just have to share the agency PIN number with your partner agency. So it should work that way. We haven't ever played with it, so it could be fun, but yeah.
I wasn't necessarily trying to suggest anything. I was merely asking a hypothetical question, just for the record.
Darn, I was getting excited.
I mean, I'm open. I'm just saying, but it's more hypothetical.
Oh, that's good news, because I don't think I breathed through that entire thing. So thank you, everybody.
And as a reminder, you'll be able to, because surely specifically with this section, you're going to be like, well, I know she talked about that, but I don't remember. So these slides are already up. Give us a few hours to get the recording up. You'll be able to get all that on the website. And again, reach out to us, especially with IT questions. We'll try to solve those immediately if there's something wonky within the OASYS system. And didn't even pay Carly to say that. I hope that here's my hope as a provider, especially if you are somebody who's new, and hopefully my current providers don't disagree with this, but it just, I am a provider. We are providers to this state, and I have expectations and I have hopes and desires about what it's like for us as a provider. And so I want to take this and I want to be as communicative without being annoying and transparent and easy to work with and understanding as we can be. There are things, and Chad and I have conversations about this regularly, about like, this is just in the P&P, and we both think that it's silly, and we can work towards making those changes through the APAC, where we make changes to P&P. And some things, it just is what it is. We know the bureaucracy of working with government funding. And outside of that, we want to be fun, which is why we talk in memes, also because we're a bunch of millennials, and as helpful as we can be. I mean, we know what it's like to have to provide these services through this funding, because we do it too. So any way that we can make it as easy as we can, we try. We aim to try. Hopefully all of these things in the chat are just kudos to how wonderful it is to work with us, but let's just double check. One clarification, care vouchers do not need an RFP. Please clarify that, Abby, because I don't know. In my terminology, I don't have a word for care voucher, so I'm not sure what that means. I'm trying to think. Technically, the only voucher program that you can write for is the material aid food program. Homemaker vouchers are something we provide internally, so that's not something that you can write for. It is not in this part. Yeah, and Amanda said up there, voucher programs is the material aid food. That's the only voucher service on this RFP. Okay, we'll get you out of here 15 minutes early unless there's any last minute questions. Give me a couple minutes to get off this, turn on the RFP system. For a lot of you, I understand. I'm so sorry that if you are a current provider, this is also the same time as annual evaluations. It is because the state said, we're going to do our annual evaluation in March, which means I have to do my annual evaluation in February if you only want to pull documentation for 1 month. If I did my annual provider evaluation at a different time, I'd be like, oh, give me all this documentation for August. And then the state's like, give me all this documentation for February. So I so far have been successful in doing the same month that the state does their evaluation. And it works really well, except at times like this, when you have an overlapping RFP and annual evaluation. I'm so sorry. I tried to give you as much time as I could for both of these and still meet the timelines that we have with the RFP and with the state evaluation. I'm sorry. Otherwise, thank you so much. Thank you for joining. Thanks for being interested in working with us. And we will talk to you soon.
Okay, bye. Thank you.